the external oblique. So this particular muscle, which we're going to find here on the side flank of the human form of the figure, is a muscle that aids in the stabilization of the torso and the abdomen. It also helps pushing the torso front in stabilizing it, coming back, but also now side to side motion, or side crunches, if you will. This motion of flexing from the left and bending from the right, the external obliques will aid in that movement as well. So this particular muscle, again, is on top of the surface of the internal oblique. So remember that there's multi layers in this area underneath the surface forms, the rectus abdominis, the external obliques, etc. So it's very thick. And again, the abdominal aponeurosis will be connecting these muscles together. Okay, so that's something to consider. So that gives you some background as to why this muscle is important and why we draw it. Now, they're on the sides here. These muscles don't necessarily reveal themselves so much. We have subcutaneous fat. As a matter of fact, this entire region is a collection of subcutaneous fat. Most of us have that, unless you're super fit or super athletic, or some people are just genetically, naturally gifted in the beginning with not a lot of subcutaneous fat. I, for one, was not one of them, unfortunately. However, we still want to learn this muscle because it is important. And you will see it at certainly at times too as well. Now, the origin of the muscle is interesting in that if you notice these grooves of the serratus anterior, right? The missile tips of the fingers or the saw blade edges are important. And what happens here, I'll demonstrate it down here, is that these grooves, as they come together on the ribs here, they attach with tendons. They're coming around right here and here and so on. The form of the obliques start pretty high. They actually fit inside those grooves like this, and they move more downward or obliquely towards the middle of the body. So they have a nice fitting relationship, don't they? They fit nicely inside of the forms. And so that's what we're going to be drawing. Now, they start, if you've noticed, I've made in green here, made an issue out of that, because the fifth rib is important for a couple of things. Remember, it helps attach where the attachment to the rectus abdominis is, fifth, sixth, and seventh, right? Here, with the external oblique, they're going to start attaching around at the fifth rib all the way down obliquely to the 12th rib, all the way, so from 5 to 12. So let's write that down over here. So we'll put 5 to 12 for the obliques. That's important to remember. So let's start to draw them out a little bit and get that feeling of the sketch. So we're going to gingerly feel them come over. Okay, so they're fitting in that groove along the rib, in through here, and moving more downward as they start to come across the body and move downward and get larger as they do. So we go all the way from 5 to 12, right? That's important to see that. They're coming down here, getting larger, and then they get really big here. Now, where they attach to is a number of places through the aponeurosis in through here. So that's some of that white tendinous connecting material. So we're going to start to shade this in, this deeply kind of striated fibrous material. And I'm going to make more definitions with the pencil form here so you can see it, but they're fairly striated. And you'll see this on the model. You'll see the serratus anterior, the visible part. You'll see what you think of the ribs, but in a very ripped or cut person or muscular person, male or female, you'll see these external obliques, and you'll see the ribs at times start to poke through as well. So you've got a lot to think of. So this is wide area, the aponeuroses here, and then we get larger here. So this attaches up and around all the way underneath to the xiphoid process and through over to the aponeurosis here that connects the interconnection, tendinous connection between the rectus abdominis, okay, down here. So this would be more of the aponeurosis down here. It attaches down to the tubercle underneath and through here a little bit. But also, and importantly so, it attaches to this inner lip of the iliac crest of the pelvis. In through here, down and over. It can pooch out a little bit, but ultimately it attaches all the way inside here on these ridges in through here. So let's start to shade this a little bit and get a little bit more familiar with this form. It's a very thinner sheet, fibrous, right, on the side of a flanking position of the model of the human form. So we have the rib cage still poking through there, moving down larger and larger. So we'll get this formed in a little bit. So again, you'll hear me say that aponeurosis quite a bit, right? And this tends to be a little flatter in here, kind of boxy, a little bit, and rounded on through here, a little bit coming down. So the external oblique here, and then the aponeurosis between the rectus abdominis, of course, and the external obliques in through that area. So let's grab this side. So remember now, 5, starting at 5, coming down more obliquely. So this particular angle, make sure we're in the camera. Okay. This particular angle, and as we move further and further downward towards the underneath part of the body, we start to get wider, larger, and notice it gets more vertical as it starts to come down. So that's particularly important. And what we wind up with is we fit into those groove notches. Okay, we're coming over here, and then we connect over really to the xiphoid process, pulls over underneath, and then we've got the aponeurosis here, the abdominal aponeurosis. Look that up. You should look up all these terms. I'm not going to write them down for you. I don't want to do everything for my students. And anybody out in YouTube land, you have to take responsibility for that. That takes a lot of time too as well for me to do that. But get yourself a good artistic anatomy book. I can recommend some if you want. The aponeurosis here, and so again coming down, getting a little wider, larger, okay, and more angled downward now. Aponeurosis here, so kind of draw that line through here a little bit, like that, moving. Takes on many different shapes. Oblique here, right, coming through on the back, all the way to that those little tiny floating false ribs, 12, all the way, pulling around. We'll see that over here a little bit better. Coming through, attaching. Now they bulge a little bit here as they come through, but they're going to come all the way through and over. And they're more forward. I need to bring this actually more forward. They're more forward than they are backwards, meaning that they attach from here. Here's the aponeurosis here. And they attach here. So back and through here we've got other muscles to deal with, the sacrospinalis, erector spinae muscles. But so they're not all the way back to the end of the posterior part of the pelvis. That's going to be important to note. I'll deal with that in a moment. So they're coming down and through here. So we've just showed this aponeuroses here. Okay. Sounds like a disease if you're not a physician. Aponeuroses. Oh, what is that? Oh, it's a wonderful fascia material. That's a connector. It's like glue. We're gluing these muscles, binding them forever together. Right in through here, down at the tubercle. So we have a connection here to the 5th to the 12th, right, to the xiphoid process over here. Connected to the rectus abdominis through the ponderosus, and then connected to the inside crest of the iliac crest of the pelvis, and ends about right there on the inside. We're looking through, so we can start to shade this a little bit. Throw a little, kind of a little, sort of a semi-highlight on these, best we can. Our diagram here. Now, I'll say this: learning anatomy this way is great. You know, this is important, but then you want to put it to good use, and that's the next section we'll do in a little bit. Is we'll start to make this living and breathing. We'll have models, and we'll look at these models and go find it through the form. That's part of how you practice it. You draw it from memory, like I'm doing now. I don't have a photograph or anything I'm working from, and that's important to know. Most of the time I don't when I'm doing these diagrams, and that's important to show that. And most good professors that teach anatomy can do it out of their head. That's important. You just don't have all data to look at a reference. It's important to know. So you can learn it so well to do it out of your head. So this pulls around like so, this fibrous tissue, and becomes that lasting part. Now this is where a lot of subcutaneous fat, right? And you can get a lot of this overhanging as well. We're going to draw a pretty fit model form to see the muscle, but a lot of times you'll just see fat, or somebody is normal, they're just naturally fit, they still have subcutaneous fat as well. I would say I've been an athlete my whole life. I'm relatively fit, heavier than I want to be right now, but I've seen major athletes with lots of subcutaneous fat there, but it is there. One thing of note, the Greeks, this entire area right here, see this little thoracic underneath the costal cartilage here, they really emphasize this in sculpture. This is called the Greek line. Right in through here, this little bulging U-shaped area that still gives us the rib cage coming through, doesn't it, nicely? So there we go. There we have the external oblique in our front position. I think that's important to denote. Okay. And so now let's go on to our side position here and put that on. So remember, now we're coming down through 5 to 12. So we start at 5, and look how it just beautifully fits, notches in that groove, right? And through here, and they just come on down and start to point downward about 45 degrees or so through the notch. They get wider as they come down. Fit right in through there. Some people call them the picket fences. They kind of look, that group, I like to think of them as just co-joining nicely, fitting nicely together and making a real tight, muscled form. Coming down the oblique, coming down through. And so we're getting close down here to the very back at 12. We've got 10 here to recapture a rib. So there's 10, 11's back here, and then 12 is right around here. And then we get wide in through here and come over, and they attach and end about right here. Remember, you're on the inside of the iliac crest in through there. So this part of the pelvis of the crest would be exposed. And clean that up a little bit. There we go. So that would be exposed. So it attaches there. It attaches again 5 to 12. It attaches and moves all the way over and attaches to my knowledge, from my reading and understanding, to the xiphoid process even over through there. And then we have the attachment to the aponeurosis here, right, to the rectus abdominis. Now remember, underneath the external oblique is the anterior obliques coming at a slightly different angle, and they're destabilizing through there. So that's pretty powerful stuff that's coming through all the way over. This is a little bit wide, but it's okay. So there's the aponeurosis here. That wider fibrous tissued area. And it will show up white on the cadaver when it's dissected. It is discolored. It is a different color from muscle fiber. Running through there. So the external obliques, keep on moving downward. There we go. Real fibrous. Cut into these a little bit, these little separate fibers, and they tend to move off the divisions as we go down further here. So I'm kind of separating them out individually a little bit. And you'll see at times, you'll see the rhythm of the rib cage come through them at times and blast on through. And so that's why it can get confusing as to which one you're seeing. You have to pay attention to their angle, which one's on top, which one's underneath a little bit. And of course you can feel the bony part of it too as well. So we come down to the end here. We'll let this rib cage pop out a little further. That's where they would crunch together or they would bend, and we get that contraction and expansion right in through there. You'd feel that if you crunch your side or bend your side. You felt that before. And then we'll just kind of render these sliding over. And through here. Put a little more shadow on these. Tighten this up and through here. This oblique. And we'll try to capture this through here. Get that out, and we're going to tighten it up a little bit of darkness. So there we are now on the side of the model, profile part of it. And then we can come down and say, okay. Let's take a look at the 3/4 and finish this out quickly. So, again, 5 to 12, right in through here, attaching through here. They have a tendency to attach kind of underneath the rib a little bit, right in through here, more downward trending to the aponeurosis. I'm going to draw that a little bit first this time. Right in through here, and maybe just a little bit over. Right in there to the tubercle. There we go. Downward trending. Downward trending even further. Just a break up, and then pretty much almost gets vertical. And then we have this kind of, the oblique can top out over here a little bit. Almost feel like it has a little secondary ridge, or like a little shelf right through there. And I'll have that kind of feeling sometimes. Sometimes this can bulge out even further, depending on the muscularity. When these get muscular, they will bulge out and makes your body look even wider when you do that. So if you're trying to lose weight and you do a lot of crunches and side crunches, people say, well, I got wider actually. Well, your muscles got developed. So sometimes this will bulge out and then come back over the crest and attach on the inside. So if the crest is here, the outer ridge here, right, this is kind of the middle part, and we go to the front and through here, then we're attaching back underneath it a little bit. So this can attach and come over and then bulge out kind of like that and downward a little bit. So we can shape it this way a little bit. Contour that around. Into the aponeurosis in here. Kind of combine these. They're glued together, held together, bonded, however you want to think of them. It's pretty amazing, their attachment, if you think about it. This has a little ridging part through there that's topping out. It gets through here, fits in through here a little bit. It just gets bulgy, blocky. Right, so we come up through here. the ponderosus into here, all the way to the xiphoid process underneath. Let that white space really show through and through here. I'll just shake this down. Then it gets almost vertical through here. And then we're on to our bigger, bulkier part of it, even though it's pretty thin sheet. And then cover it on top. Now the subcutaneous fat's on top, folks. That's not underneath, not deep fat underneath it, but it's on top. And we'll kind of make this feel like it's connecting. If we can, with those connect. So there we go. We have now the three kind of drawn positions of the external oblique now in our composition. So now you've got the system working for you, and the next muscle we're missing, and that we'll practice in the next video, it's pretty obvious. You can take a look at the chest, right? You'll see it's the pectoral. So it's up here. It's missing here, here, and here, and we'll talk about that. That's the most surface protruding of these front torso muscles, and they're pretty dominant, and we'll talk about them in their entirety and draw the pectoral major mostly. The minors, pectoral minor sits underneath there, and it's not as relevant for us surface-wise. It doesn't necessarily excuse me, pop out as much. So we'll look mostly at the pectoral major, pectoralis major through there. So that's coming up next. All right, so that was it tells me I need to stop because I've broken another pencil. So hard on pencils. All right, so that tells me now we've got this muscle group, the serratus anterior, the external oblique, and then the rectus abdominis. And next, last for the torso in the front is the pectoral muscles. Okay, pectoralis major. All right, see you then. Bye-bye.